Hello, everyone, and welcome. My name is Heather Aliano, and I'm the Communications Director for the One America Movement. Thank you all for joining us for another episode of Candid Conversations. At the One America Movement, we know that taking the time to listen and learn from each other and working together despite our differences is imperative to reducing toxic polarization. We know that everyone in this country is experiencing the pandemic a little differently. Candid Conversations is a part of our new Corona Rebuild initiative, where we connect the challenges of COVID-19, the divisions in our country, and the roles we each have to play in order to move forward together. So every Friday, we'll feature someone from the One America Movement Network on our show to get candid about how the coronavirus pandemic has affected folks and communities across the United States. We'll cover issues related to race, food insecurity, health disparities, mental health, and much more. Joining us today is Dr. Brian Williams to discuss his experience. Dr. Williams is a trauma surgeon best known for his role in treating the victims of the 2016 Dallas police shooting. Prior to becoming a physician, he was an aeronautical engineer in the U.S. Air Force, and he's currently serving as the Associate Professor of Trauma and Acute Care Surgery at the University of Chicago, is the host of the podcast Race, Violence, and Medicine, and the chair of the Dallas Citizens Police Review Board. And if he's not doing enough already, he's also the vice chair of our own One America Movement Board. So welcome, Brian. We're excited to have you.
Thank you for having me, Heather. Pleasure to be here. And I must say, I need to give credit to the new chair of the Police Review Board in Dallas. That job has been passed along to my friend Jesper Warbu in Albuquerque, who's doing a fantastic job down in Dallas.
Wonderful, wonderful. Well, we appreciate your service on that before, and we hope it continues to do good things with the new leadership. So I know that we have a lot of ground to cover this afternoon, but my family recently moved to Illinois. So as a new transplant here myself, I have to ask you, what is your preferred way to eat pizza?
With my hands?
What type of pizza, I guess, is the correct question. Is the right pizza?
It's just the Chicago, the deep dish pizza, it's too much cheese for me. It's just too heavy. I prefer the New York style pizza. I hope I don't get run out of Chicago for saying that. But as I get older, I have a little bit of a lighter appetite. So the deep dish Chicago pizza it's too much for me to handle.
Oh, I bet. I can't imagine that you've had much time to eat pizza these days. You're a trauma surgeon in Chicago and recently have been working with COVID patients in the ICU. What has that experience been like for you?
Well, so being a trauma surgeon and to really educate people, trauma surgeons across this country really have two specialties. One is doing the trauma surgery, but the other thing that we also do is critical care. So all of us have two board certifications, one in general surgery and one in surgical critical care. So that critical care part is the part that deals with the COVID patients. So that's the intensive care unit. These are patients that would be on life support, so on breathing machines. They may be getting medications to keep their heart going and their blood pressure adequate. So that is the specialty for me where I'm dealing with COVID patients in the intensive care unit. Now, just be fair, for the past few weeks, I've been all just completely trauma because gun violence has been a big issue in Chicago for probably about the past 6 weeks has been really ramping up. But in the beginning of the pandemic, when Chicago was at its peak with COVID, when I was in the ICU, what the experience for me was I noticed that these are almost exclusively Black patients that were in the ICU. And my gun violence victims I see are almost exclusively Black victims as well. So for me, it was disheartening to see this intersection of death and illness and tragedy in the middle of this pandemic that was primarily affecting Black Americans, especially when in Chicago, the population of Blacks was about 30% of the city, but the number of gun violence deaths was 70%. The number of COVID deaths were 75%. So you see an outsized representation in the deaths from these dual pandemics in respect to the population. And Chicago is not unique in that. You see this happening across the country. Many other cities are reporting similar disproportionality as far as the impact of gun violence and COVID. And it's also affecting Native Americans, it's affecting Hispanic Americans, it's affecting Asian Americans. But we look at all of the racial and ethnic minorities that are impacted by COVID, Black Americans are about 2 to 3 times higher than any other race or ethnic demographic. So right now, COVID-19, as well as gun violence, are having a significant tragic impact on Blacks across this country.
Right. I've seen the data that communities of color are disproportionately affected. I read your article that came out this week about some of the reasons this is happening, that some areas are sicker than others is due to redlining that occurred way back in the 1930s. And as I've had this conversation with people in my network, I've been having a lot of questions from well-meaning folks who are trying to understand, why would somebody choose to live in an area that is historically unsafe or unhealthy? How can we better help people understand the complexity of that issue?
Yeah, it makes sense that if you are living in an area that is unsafe, if you're living in an area where there is little economic opportunity, that you would just pick up and go somewhere else, right? But that is no easier for someone who is economically depressed than it is for me. It's not easy for me to just pick up and move my entire family across the country, and I'm employed. So I think that narrative is something we really need to address about individual responsibility and individuals choosing to live in areas that are unhealthy and unsafe. But you mentioned a bigger question there, issue is, what does it mean? What does redlining mean? And how does that have impact today? And I've had this conversation as well. And I realized that my insight into that is not understanding what everybody else has. So to explain redlining, you have to go back nearly a century in American history and think about what happened after the Great Depression. And there was a law called the National Housing Act of 1934. And the intent was to help rebuild society as part of the New Deal, to provide funds for individuals to buy homes, to provide funds to build new homes. But explicit within that law was to maintain racially segregated neighborhoods. Therefore, if you were a mortgage lender, you would get a map, and on that map, there'd be neighborhoods that were redlined. And if a neighborhood was redlined, that meant that only Black people could live there. If you weren't redlined, you could not. A Black person like me could not go into a non-redlined neighborhood to buy a house. The mortgage lending practices were different, so it was more difficult to get a loan to buy property in a red line neighborhood. And because of that, there's a cycle, right? Lower property values, companies divest. You do not want to invest in an area that is not economically thriving. So all the resources left the red line neighborhoods and went to the non-red line neighborhoods, which, that's a proxy for white neighborhoods versus Black neighborhoods. I'll keep it simple in those terms. I'm not trying to exclude any other demographic, but to keep this conversation understandable in terms of Black and white. So red line neighborhoods, hard to get a loan. That's where Black folks were living. If you were not red line, easier to get a loan, and that's where white people lived, and that's where the businesses went. So move forward, you have generations of Black people that could not get a home, could not own a home, which has huge implications, because the number one means of transferring wealth between generations in America is through home ownership. So if your great-grandparents owned a home, they pass it along to your grandparents, you pass it on to your parents, and that wealth stays within your family. But if you were not allowed to buy a home in the first place or get that loan, you do not have that means to transfer wealth to your offspring. So that's where you see the beginning of income inequality that has persisted to this day, the lack of home ownership. So that's 1934, Heather, the National Housing Act, redlining. So I'm going to move forward to 1968, right? The Civil Rights Movement, the Civil Rights Act, we're going to remove all these discriminatory practices. And in 1968, we had what was called the Fair Housing Act, which essentially said you can no longer discriminate based on race and among other things. So as a mortgage lender, you cannot say, okay, you cannot move into this neighborhood because you're Black. Those practices all went away. However, by that time it was too late, right? By that time, we've already had a system in place that has segregated Blacks to certain neighborhoods, that has led to economic divestment, poor schools, poor infrastructure, lack of job opportunities. And to suddenly say, you know what, there's no more barriers, you're fine, go chase the American dream. That is unrealistic
Right.
in that situation. If you've had the weight of the government working for generations to intentionally exclude you from mainstream society, to sweep aside the barriers and say you're fine is unreasonable. You have to move forward to having policies that are inclusive, to say, okay, now we're going to bring you back into mainstream society by doing X, Y, and Z. And that's where we've fallen short in this country, in my opinion. And that's why we still see these inequities playing out today. And connecting the dots, that's why there's so many Black Americans dying from COVID right now, because of a lack of health insurance, access to health care. There's so many things going. We can go on all day, right? So that's a lot there to digest. And Tree may have some questions there, but just remember these two things: the National Housing Act of 1934. Look that up, and then fast forward to the Fair Housing Act of 1968, and see if you can connect the dots between what's happening now in the middle of this pandemic, because there's a lot to unpack there.
Man, I appreciate you taking the time to tell us that and to spread out the story. I had great teachers throughout my education. I know I did, but I didn't learn about this in school. And I know I'm working to try and teach my children this history so we can have a better understanding of why the world is the way it is right now. And so we can work on those policies to make it better. So I have my next question for you. Takes us back a little bit in your timeline. I remember seeing you on the news back in 2016. You gained national attention after you led the trauma team that cared for police officers who were ambushed by a sniper in Dallas at a Black Lives Matter rally back in 2016. I was reading an article that came out last week marking this 4th anniversary of the tragedy, and saw that you had mentioned how this incident had forced you to really look in with yourself. Could you talk a little bit more about that experience and what it taught you?
Sure. So the July 7th shooting in 2016 was a seminal event in the city of Dallas. It was a turning point in my life personally and professionally. And I think it was also a huge event for the country as a whole. Now, to truly understand the significance of that event on so many levels, I think it's important for us to go back to that time period. This is the summer of 2016. This is leading up to the 2016 election between Clinton and Trump. So if you recall what the atmosphere was like in the country during that time period, it was also weeks after the Pulse nightclub shooting in Orlando. So we had that mass shooting that occurred, I think, about 4 or 5 weeks prior to that. And then the protests occurred the day after Philando Castile was shot and killed outside Minnesota. If you recall, that was his girlfriend streamed his death on Facebook Live when it happened. And after that shooting death, there were protests occurring all across the country, very similar to what happened after George Floyd about a month and a half ago. But the one in Dallas was the one that gained attention because it turned deadly. There was a sniper who ambushed the police officers that were there providing security for what was a peaceful protest. Shot 14 officers, 7 were brought to the hospital where I worked, and the remainder went to a crosstown hospital. Of the 7 that came to our hospital, 3 died. And it's still the worst night of my career, and it's something I think about every day, especially around the time of this anniversary, which I'm making sure that's a good word to use for that. I'm not sure how to commemorate that, but generally around that time, I tend to check out from society. I don't watch the news, and I'm off of social media, but I do get questions every year from media to comment on the event. But it was also at a time in my life where you mentioned there's things that you just didn't know or talk about. Look, I did the same thing. I was not one to step into this conversation about racial justice or systemic racism because I did not want to deal with the potential repercussions of my doing so. I was comfortable in my role as a doctor. With that came some privilege in society, but that did not mean I was immune from from racism and everyday racist events. But it was something I internalized and just kind of dealt with it and told myself, well, it's better than what my parents had to deal with. So what do I have to complain about? But the reality is, those of us with privilege, like you have privilege, I have privilege, one America, it is incumbent upon us to use that privilege to speak up and act upon on the behalf of those with less privilege than we do. So when that event occurred, and I'm thinking about there's a black sniper targeting white police officers, after Philando Castile, Black Lives Matter, you have there's Blue Lives Matter, All Lives Matter, all that was happening. I had to look internally and said, okay, Brian, what are you going to do to contribute to a solution to this? I did not have an answer, but I knew that what I was doing, which was nothing but staying quiet and silent and avoiding the controversy, was not helping the situation. It kept me safe, but it did not contribute to bettering society in ways that I felt that I could. And that's what led me to eventually speak up at the press conference and talk about these things: gun violence, systemic racism, police brutality, in a way that I felt I was not taking sides. I was just saying, look, these are the facts. Let's talk about it. But you always, no matter what comes out of your mouth, Heather, it's how people hear it that matters. And people heard very different things from the exact same phrase that came out of my mouth. Some called me a sellout. Others said I was being racist myself. Others criticized me, saying that I should never be able to take care of white people or should not be able to take care of police officers. Some even said they're glad that I let officers die, which was not the case. Like, we don't allow people to die, and it's never been part of my ethos or the oath I took to be a doctor. Like, we treat everyone with humanity. We recognize everyone's shared humanity, no matter their background or their profession or their race, ethnicity. It's like, these are human beings that are suffering and dying. We are there to help them. So that moved me from just being a doctor to now being, I call a surgeon activist, to being more outspoken about these issues and trying to force the conversation and force people to action, so that we can all do our part to create a just society. We got to do it every single day. Stand up and do what you can to create a just America.
I love that. I've seen some of the work you've done across this country, working with the police and communities and bringing them together to have these hard conversations. And that's a lot of what we do here at the One America movement. We're trying to connect people across big divides, racial, political, religious, to tackle hard issues. And I wanted to ask, what has that experience been like, trying to work with police and community and that relationship? How has that gone for you?
Yeah, so a little over a year after the shooting, the mayor of Dallas asked me if I would become chair of the police review board. The prior chair was terming out. He could only do so many terms, and it was also during a period where police and community relations was a huge issue in Dallas, but not just nationally as well. There was a task force in Dallas to look at policing in Dallas. There had also been about 40 years of work prior to my getting on the board that community leaders and activists had done to try to work towards collaboration and also police accountability. So when I stepped into that, I was coming in toward, like, they're near the finish line, they're near the goal line, and I was just kind of there just to help them get them across that goal line. But it was at a very pivotal moment, because if you think about it, Heather, you have community activists, you have community leaders, whether they're business leaders or politicians. You have the law enforcement officers. You have the unions. And depending on who you're talking to, they have different agendas. And they have different ideas about what this should all mean. And they don't always agree. So I felt it's important to just really emphasize, like, this is about public safety, right? And you cannot have public safety if the public does not have trust in those that are providing that safety, right? If the civilians do not trust the police department, then public safety is compromised. And to ensure trust, you need to have some degree of transparency and accountability. And in the absence of that, there'll always be this chasm. And accountability is not about punishment. It's just about transparency and trust. So that was the messaging that we were working on as a board during this time of this transition to for reform, and trying to get the board some more authority and effectiveness. Because when I took over the board as chair, there were 14 members and me, so 14 for each council member plus the chair appointed by the mayor. However, we had no budget, we had no staff, so everything we did was volunteer. And it's impossible to be effective to do any sort of job as far as oversight for a large urban police department when you have no resources to do so. So we worked to get a budget, get a staff, but also get training for the board members, and work to get some more collaboration between the community as far as input and working with the police department. And so that's where they are now, and they're moving forward from that. So it's not the end, it's just a new beginning to the next phase, because there's a long, long ways to go.
Right. It's such an interesting concept. Is this something that most cities have, or is it kind of a new initiative that Dallas started?
No, and I don't. Many cities have some form of police oversight, and not all, and it varies. Police oversight, I started becoming an issue, a big deal in the U.S. around the 1920s, around this Great Depression time. And if you think about oversight, there's probably three buckets. There is just a review kind of model, which is the first models that came out. There is the investigative model, and then there's hybrids. So a review model is something happens, the police department does their investigation, they give it to you for review, and you say, yeah, yes or no, but you really can't have any input to make any changes. So that's a reviewer model. That's been proven to be largely ineffective. Mm-hmm. That was started in the 1920s. And when I came on the board in 2017, that was a model that was being used in Dallas, one that had been proven nearly 100 years before to be ineffective. The investigative model has one where you have investigators that are actually able to essentially investigate the police department, which has its own kind of complications. You do not want to have frivolous investigations. You do not want to put police officers in additional administrative or legal jeopardy because of an independent investigation. So it gets very complex. Then there's a hybrid, which is somewhere between the two. I would suggest, if you're interested in learning more, there's something called the National Association of Civilian Oversight of Law Enforcement, NACOLE, NACOLE. There's information there, and in short, it's not a one-size-fits-all. It differs based on municipalities, cities. So there's different things that work differently for different locales. But in the end, these concepts are still the same. Public safety requires public trust. Trust requires accountability. Accountability requires transparency. If one of those four things is not working, then you can expect that in the end, there will be some chasm between civilians and law enforcement. And that's just what we do not need, especially now, right? We need to close that gap somehow.
For sure. Thank you for sharing about that. I'll have to check it out. It's frustrating to walk through this time and to not know what the next step to take to work towards better policy and changes. I want to do more than just protest. So it's to have a place that we could focus our attention. We're starting to wind down a little here, but there's been a question that we like to bring up with most of our Candid Conversation participants, and that's about your vision for the future. We want to make sure that we're working and building towards something better for all of us. And you've talked a little bit about the fact that we as a nation still have a lot of work to do and that we can't get complacent. And now that we've reached a point where Black Lives Matter is not the top trending hashtag anymore, and the news cycles are hyper-focused once again on our new normal of COVID-19 coverage. What do you think the best way forward for us would be, and what is that better vision of the future for our nation?
Well,
big question.
I have grand ambitions that together we can build a just society. And I also accept that there's probably no end point to what that means, right? But we all can do something every day that when, our days are numbered on earth, we can look back and say, at least we left the world a little bit better than when we started. At least I worked every day to stand up for for justice and work towards a just society. And how each of us does that, you have to find what just gets you motivated, what keeps you energized every single day. If that is marching in the streets, march. If that is calling out one of your friends for saying something racist or insensitive, do that. If you want to write, if you want to, we're doing this Facebook Live today. All these things make a difference, right? In some way, we're moving, we're shifting the molecules and moving the world towards a better place. And it's not always easy. There will be setbacks, but in the end, as long as we're making progress and we're doing this with integrity and consistency, and focus on like what we can do to make a better society, and not what we can get out of society. What can we do to make society better? Then, I mean, that is kind of the vision of One America, right? That is the vision of One America as we address toxic polarizations, what we can do to recognize what makes us, what divides us is less important than what unites us. So do your little part every single day. And at the end, we will make incremental steps forward.
I love that. Do you? That's great. That's great advice. Well, unfortunately, that's about our time for today. I don't want to take too much of your time because you've got such important work to be doing. Thank you again for joining us. And before you head out, where can people follow along and learn more about you and the work that you're doing?
The easiest thing to do is just check out my website, brianwilliamsmd.com. That's Brian with an I. And if you go there, it'll show you my social media tags. I'm most active on Twitter and LinkedIn. You can also email me through there. And I do respond to everybody. It may not be right away, but I will get back to you. And if you want to hear me talk about some of these issues, I have a podcast called Race, Violence, and Medicine. But again, all that information, if you just go to brianwilliamsmd.com, it will be there somewhere on that website.
Wonderful.
Thank you for having me, Heather. Thank you for having me.
Thank you so much again for coming. All right, everyone. Well, make sure that you check out Dr. Brian's website, and also check out our website at oneamericamovement.org. You can also find us on Facebook, which is probably where you're watching this video. So thank you for watching. And also on Twitter at @one_America. Make sure you join us next week. We'll be having another conversation about domestic violence within this pandemic and how communities are dealing with that with the ladies from Rebecca's Tent in Atlanta. So until then, have a great weekend, and we'll see you next time.